More screening points at the Bole International Airport in Addis Ababa, placed strategically to capture all passengers as they pass. The coronavirus screening is being done concurrently with the Ebola virus screening that has been in existence since last year.
Most of the passengers pass through 3 thermal scanners. So if we miss by one of the thermal scanners, another 1 or 2 will capture, so that we are very confident that the febrile passenger will be captured at least on one of the thermal scanners. And if there is a suspicion that a person is having EVD or novel coronavirus, there is a duty physician composed of the well-trained medical doctors and the nurses. They are working 24/7, so that our screener contact our physicians. They will evaluate the suspect further. If they are fulfilling the case definition for either of the diseases, they will isolate in the temporary isolation unit that is found here in the airport.
Passengers are expected to fill these health checklist forms. More attention is given to those coming from countries identified to have cases of the coronavirus. At least 21 countries have reported coronavirus cases.
Anybody who comes to Addis Ababa have a screening form, and after screening, during their stay in the city, they have daily follow-up from the health workers, so they can be assured that if something happens, they can be isolated very early.
At least 30,000 passengers pass through the Bole International Airport in Addis Ababa daily. And with the upcoming African Union Summit in February expected to attract more, the city administration says it is well prepared.
We have prepared 5 isolation centers for primary care in case if they need an intensive care unit. We have already prepared at St. Peter Hospital and Alert Hospital. If they really need a close follow-up or intensive care unit follow-up, we have already prepared, and I think we are ready to host this African Union Summit in our city.
Tests of 4 coronavirus suspects in Ethiopia have been proven negative after tests were done in South Africa. One passenger who came from Beijing remains in isolation. Ethiopia's national carrier, Ethiopian Airlines, says it will not suspend flights from China. It says China is one of its strongest and oldest destinations. But neighboring Kenya and Rwanda have decided to temporarily suspend their flights to China. Concern has been raised about weaker screening in many African countries. But the African Centers for Disease Control says it is pushing for more coordinated continental efforts to prevent spread of the virus.
We've mobilized our rapid responders. These are a group of people that we are training earlier on in anticipation for a day like this. So next week, they will all gather in Addis Ababa, harmonize their training, and be on the alert. We'll distribute them regionally such that if there's an outbreak in any member state, we quickly support member states from the region, from our regional collaborating centers with these individuals that have already been trained and in a coordinated and standardized fashion.
The African CDC will host a workshop in Senegal next week for at least 18 countries considered to be highly vulnerable to the coronavirus. They will receive training and also get testing and detection kits. Colette Njohi, SABC News, Addis Ababa, Ethiopia.